flip the script. You'll be initiating and wearing his ass out. Welcome back to the channel with me, your host, Dr. Debra Durst, and I have a special guest with me today who's actually a patient and is going to talk about her experience with hormones, sexual wellness, and just, how her life has been improved with all of that. So welcome, Tiersha.
Thank you.
All right. So I'm so glad you took time out of your day to come and just talk to, women and men about, just things that they can do to improve their life. And honestly, they don't want to hear it from me all the time. They would rather hear it from somebody else. So I think this is a good opportunity. And we're just going to have a conversation, just like we do in the office.
Okay.
And girl, you're usually like very open and comfortable with me in the office. So I'm sure that will happen with this too. So how did we end up? So just tell me how we ended up together. Like, how did you end up in the office with me?
I did some research online and I found you through podcasts and YouTube. Listened to a lot of your videos and liked your approach and how you were constantly with the patient and staying on top of all the levels and constantly adjusting. And so I was lucky enough that you were right here in our backyard. So I reached out to see what we could have
to come into the office. And it's actually kind of funny because I don't think as many women, just to touch on that part, are on YouTube as men, at least. And I'll ask all the time too, like, how did you hear about us? So it's not a very usual that it's YouTube, but when it is, it's like, well, I was watching videos and then I realized that you were right here in Knoxville. Mm-hmm. So we do hear that. We get remote patients, but we get a lot of that too. So that's interesting because I didn't recall that fact. And so we sat down and meet. So like, if you want to just tell about the experience, like the first time in the office, how comfortable you were talking about it, or was it, just hormones, like the symptoms that you came in wanting to discuss?
I came in specifically for the hormones. I had tried a lot of natural remedies at home first, trying to take, what I could naturally. Mm-hmm. And that wasn't getting me a lot of places. And your podcast and several others was always talking about, you don't know what you can't measure. And I was like, well, I've not had anything measured. So of course I needed to have the blood work done. The first visit, of course, was coming in for a consultation with you, and I'd had the blood work done prior. So you had all of that in front of you, but it was a very comfortable conversation. As you're aware, I'm not very open normally and talking about conversations like this. I'm normally a modest person, but you made it very comfortable from the get-go to be able to talk about these things.
Yeah.
Made it feel more like a friend talking to me instead of a doctor-patient scenario.
And it's funny, I didn't really know that she was that modest because she's always been very open with me. Like, so we've always had very open conversations and they flow. So I never really got that. You weren't shy at all, which is good. And I always want patients to feel that way anyhow, that they are comfortable talking about anything.
Yes.
And that's important because some of it can be a sexual, issue that somebody might be having. So what were some of the symptoms that you were experiencing?
I was having a lot of mood swings and I knew it wasn't normal. Like I had gone through what I thought was depression, a bad spell of that. And I was refusing to do any medication with that. And the more I was doing research at home, the more I was finding out that it was probably a lot of it was based on hormones. I was at that age point, and I didn't like how angry I was getting. I didn't like how depressed I was getting, and I knew there had to be a better way. I had started gaining a lot of weight. I just wasn't sleeping well. I was not feeling myself. I did not have any sexual desire, all of those kinds of things. And so I knew something was wrong. Like I've always been pretty tuned in to myself and the energy around me and all of those things. And I just knew something was off.
And clearly something was different. And was that initiation of sex like something that was definitely different for you? Or was that something that, because a lot of times women will come in with a lower sex drive and it's either one of two things. Either it's a significant change and it's one of the reasons why they're there, or that isn't the primary reason. So was that like one of the big symptoms that you were having, that low sex drive and
Yes.
just not the interest?
Yeah.
All right.
And I didn't know, I've got 2 children and, they were growing older and we're busy with schedules. And I didn't know if it was all, people will say that happens a lot, but that was still not it. Like there was more to it than being busy and working and all of those things. I just knew there was something more.
Yeah. And I think that that's also very common for women to think, is it everything else? Because there's so many things that women are balancing that it easily can be blamed on something else. And we
Yes,
overlook it for
we
a
do.
period of time. And so how many years or how long had those symptoms been going on? And had you seen like another doctor, or did you bring it up with any of the other doctors that you were seeing?
I had, looking back now, I can see the timeline more clearly than, you and I have been together, 2.5, 3 years now?
Yeah, it's been a little while.
Yeah. So I had gone to my OBGYN years ago, and she wanted to put me on progesterone. I tried that, and it did not do well for me. I did not like the way that I was feeling and reacting to that. So I just completely went off of it and just had kind of dismissed that years ago. But
were you doing capsules or creams? Do you recall?
it was a capsule.
Okay.
It was a capsule. So anyway, the biggest thing was, looking back, the depression state had been about 2 or 3 years prior to me coming to see you. And that was the big thing now that I can see. I had also had 5 or 6 years ago started having some irregular periods. I had always been like clockwork every month. And so I would have an irregular period every 5, 6 months or something. It would just be out of the blue. It would surprise me. And that was getting tedious and cumbersome, right? You don't want to be surprised with anything like that. So now that I've been with you and I've done a lot of research and I'm aware of the benefits of all of this, I can look back now and see that prior to me starting on this, it was a good 6, 7, 8 years before I started this, that those little symptoms were creeping in that you just dismiss because you're busy taking care of everybody else. You're busy working and you're just like, oh, I'm at the age that maybe this can happen like this. But when you have regular periods your whole entire life and then all of a sudden something starts changing, I was still young. I was still, my early 40s. I didn't want to think about any of that.
Yeah.
That's not happening to me yet. I'm too young.
Yeah. Well, and plus there's still, again, so many things going on in your life. Is it stress? When did I have it last? Sometimes we probably even forget, because life gets so crazy. So it sounds like, a period of time. And again, women frequently are asking, at least we're talking about it a little more on social media now, and educating that they're in their late 30s or they're in their mid 30s or early 40s. And they're like, it can't possibly, like the symptoms I'm having can't possibly be me. And it sounds like that's where you were for quite a few years, even before 5 or 6 years before you came in or more.
Yeah.
And so, so we always do blood work and then we sit back down and again, do you feel like you understand, not even just the first time, but over time, do you feel like you understand hormones? Like, and what's going on now?
I do.
Okay.
And that was one of the biggest things. Even now, I can talk to my friends who have done some hormone therapy with their regular OB and things. They'll get tested one time and they're put on a dose and then they're just expected to stay on it, right? 6 months, a year. And I'll ask them, well, when was the last time you had your blood work done? When was the last time this was checked? And they were like, well, my doctor's not wanting to do that, until a year out or something. And I'm like, time out. Let's talk about this, because we change so frequently. And it did take us a long time for me to get mine fixed. It wasn't overnight. Now, the very first time I got that testosterone, it was amazing. That very first day, like I walked out of your office feeling amazing. But I will say that I think that was just the reaction of being so low for so long with it. But I did fluctuate up and down for that first year. But I felt like after that first year, we got it right.
And I remember having conversations. Again, I remember you one time, I think you were like, upset and a little anxious during a blood draw. And I think they brought me in just to, like, again, answer some questions that you had. And really it was because you were approaching blood work again and dropping. And so we had talked about an injection in the office. And bridging until that next week. And so again, until we get, sometimes we'll do that. And which is one reason also why you'll feel better if we're doing a pellet, we'll do injections that day. It kicks in the pellet a little bit quicker, and somebody will absolutely be able to feel better a little bit sooner. But also if you start to drop off until we get your dose right, sometimes we'll just boost a little bit at that blood work appointment a week before. But it sounds like we did that for a little while. And I do remember that. I remember you weren't like, but I just kept saying, hang in there. Like we're, we don't get it right away.
I feel
Every woman's different. Yeah.
Sorry.
Yeah.
I feel like I was taking advantage of your wellness program for sure that first year by getting those booster shots, by coming in and having the extra blood work, because that's why I'll refer anybody to you and RevitalyzeMD, because you were so, I can't find the right words for it, but you took good care of me when I was worried about my levels fluctuating so much every 3 months. And so I would come in. There was multiple times I came in for an extra blood draw just to get my levels checked then, and we'll still do that now. And so I think that's the benefit of the wellness plan that you get on, because it's all encompassing.
Yeah. And we actually had a recent discussion with somebody else that kind of like had fought getting on the wellness plan, and then a lot of questions and difficulty. But then, we just can't customize if you're not, like, that's one of the, I think it became clear to the office, like that's why we do that, is because we want to be in touch with, we don't want them to have to worry about coming into the office unless we need blood draw. We can actually tweak through some problems just with a conversation and adjust some things. And so we like to it's just customize. Everyone's different. And so you're going to be different than everyone else. And you may need more frequent blood draws. You might need a year of, customizing until we get it right. But the goal is to always try and get it somewhat right, so that, you're not as time intensive for you, because we don't want you to have to drive in and, get blood draw. Nobody loves that. But again, until you felt better. But so how are you feeling now? It was 2023. Like so it's been 2.5 years or right there. So how are you feeling now with everything?
Overall, I'm 100% better. Now we're dealing with my estrogen levels are getting low. So I've only been on the progesterone and the testosterone because I had a little bit of estrogen left. And so I do feel like there's a couple of things coming in and out now that I'm starting to question. I'm just like, could it be this? Could it not be? And so I'm anxious to see what will happen this next go around, to see what that's going to look like, and how we go from there, and how, if I start the estrogen, how that's going to do. But looking back 2.5 years, I feel like I'm a completely different person.
And I will say, when you bring that up with the estrogen, so one of the issues in that perimenopause stage, and it's a transition stage, can be up to 10 years, and it could be longer or shorter depending on the woman, but that's a transition, and our hormones are all over the place. But estrogen's the one that's all over the place. Usually it's progesterone and testosterone that are dropping, and it's estrogen all over the place that causes a lot of the anxiety, the mood, the weight gain. Sometimes it's like the premenstrual stuff we have when we're young and menstruating. It's the same thing in perimenopause. And so some women will get excessive bleeding, not just irregular periods. And so, but anxiety and mood, when it's an issue and you're estrogen dominant in perimenopause, you definitely do want to go slower. We like to get that transition and right about when you're crossing over into menopause. Some people, maybe we can do that earlier, but with mood, probably, a little slower progression with that. So yeah, we'll follow your estrogen and see exactly when you need it based on symptoms and levels. And so, yeah, but we'll go slow with you. We don't want anything to, bump that estrogen up where it was before, right?
And that's another reason I've been with you, is because of the care. I don't want anything rushed. I'm not a person that likes a lot of medicines. I try to stay away from that, try to go the natural route when I can. And you've been very great to just gradually let me get into these things. You're not putting me on a one-size-fit-all plan. It's something that is personalized just for me. That's not going to be for anybody else. And so I feel really special with that. Yeah. And knowing that it is making me feel better and my life better, then I'm like a champion for it.
Yeah, no, well, and word of mouth and patients that are happy is like, again, the biggest compliment for us. And so have you seen Faraday or Nicole yet too?
On the last visit, you introduced me to Nicole.
Okay, yeah, because we again, Tiersha's been coming to us for a while, and so she saw me. But Faraday, you could probably seen either of us, but we do practice the same. And so I always reassure patients if ever, I'm not seeing patients as frequently right now, that I always just reassure that, I train everyone that's providing services at Revitalize. And so you get the same care. And if there's ever questions, but they customize exactly the same way, which is good. But it also brings us to like the sexual wellness. So libido and sex drive is one part of it. And I always look at that at more of a systemic, where that's maybe more of a testosterone. But obviously, if we're aroused, then that helps. But when it comes to sexual function, because you've had some of our sexual wellness treatments, so I also wanted women to hear those experiences as well. So what were some of the symptoms that we were discussing sexual wellness with and then those treatments that you got?
It might have been the very first visit we were talking about. Was having a little bit of incontinence. So I've got 2 beautiful, healthy babies. They were on the large size and I had them naturally. And so I was having a little bit of that issue. And so you sent me home with some books to read. And so one of them was about the O shot. And I pretty much devoured that book in a couple of days and was sold that with some additional videos that I watched that you had done early on with all of those and became really intrigued. And so then that's when the next visit with you, I started asking about it and we got one scheduled pretty quickly. On the front end.
And you had the laser treatment with the O shot,
Yes.
right? And so the Votiva and was, we get a lot of questions. So number one, incontinence is, something that the O shot helps with in the laser treatments. And I usually will really say to women, I think we should pair because even if they're thinking the O shot or come to us because, they've read about the O shot even prior to knowing about our office, I always warn them that I think go get enhanced results if we do the laser with it because you're heating the vaginal canal and then you're doing the O shot procedure. But tell any women out there, is it painful? Like, are either of those painful?
No, schedule it. Do it. Like there's no reason not to.
Yeah, no discomfort. Were you nervous about it still prior to having it the first time?
I was. But I was also comforted because being a natural type person like I am, it's my own blood. There was nothing synthetic about any of this. I knew that you had, comforted me knowing it was not going to be painful. And so I knew it was everything of my body going back into my body. And it was just going to try to help with the situation that I was in. I was comfortable in the office. Procedure took an hour?
Yeah, an hour with the laser before it.
Yeah.
So, and a lot of women won't believe it's not painful until they actually have it done. So they'll be a little nervous leading up to it. But then they realize after. But yeah, so the laser is just that heating. So again, giving tissue back what it needs, communicating that there's some kind of injury for women that might not know what the laser vaginal rejuvenation is. So you're basically taking a laser and surface heating to tell the tissue it's injured so you get repair. And then we have already drawn blood. We spin the blood down and we get the platelet concentrate, and platelets have growth factors in them. And then we re-inject them back into an area to, again, get repair and stimulate repair. So it's blood flow, better lubrication, better orgasmic strength, potentially, improvement of incontinence and support of the urethra. And so were those all? And that's just for anyone that might not know what those are. In the O shot, we are injecting those back in to the clitoris and the G-spot. And it fills the space in between the vaginal canal and the urethra. So that's the procedure. But we do lots of things to make that something that you don't really feel much of. And that's where I love that you're sharing your experience with it.
There was no downtime whatsoever. I mean, I got up. There was no pain whatsoever. You could tell that there was a little bit of, felt like
Pressure.
a little, not even that. Like it was a little tender and swollen down there, like excitement. And then, immediately can go home and have any kind of activities you want.
Yeah. Well, and we do tell women, so it's not all women that have that, but I'm like, listen, the question frequently is, number one, is there pain? Two, can you have sex after? What's the downtime? And so I'm like, well, there's no downtime. Some women actually feel engorged and want to have sex. And so if that's you, have sex then. And there's no downtime. But if you don't, or you're tender, then don't have sex right away. But you were able to, and actually kind of
Enjoyed
sounds
it.
like, yeah,
Yeah,
it sounds like
completely enjoyed it.
Yeah. Yeah. Well, that's good. Women like to hear that because
Right.
not everyone, everyone's different with that too. But what about incontinence? So how long did it take you to get improvement? You had mild incontinence that was happening.
Immediately.
Okay.
I don't remember having any issues whatsoever from that point on. So it was almost like a immediate solution for me. Now mine wasn't real severe, but sneezing, coughing, that kind of thing sometimes would happen. And I remember I'd completely forgotten about it. And then, I don't know, a couple of weeks later, whatever, I had a sneezing fit. And I was like, wait a minute, nothing happened,
Yeah.
And it was one of those things that you just kind of forgotten about it until you're reminded sometimes like that. You're like, oh, that could have happened that time. And it didn't. And yeah. And you said it might last, 6 months to a year. And my results lasted almost a year and a half. So I was very pleased.
And then you started to get a little mild incontinence back again. And then we had recently repeated both, right? Or was it what did we repeat with the
I
most
did not do
recent?
the O shot this time. I did the, I had two different.
V-tone and Votiva.
V-tone, there we go. I had the Votiva again, but the V-tone this time.
All right. And how has that went so far?
It has stopped the incontinence again. I did not have the engorgement and the fun that I had with the O shot.
All right. So yeah, well, that's good
But
feedback to know too.
right.
Like in comparison with.
Right.
So the engorgement, not just after, but do you feel like the orgasmic strength? Because even after, because some women don't really come in complaining, and it doesn't sound like you were either, that the orgasmic strength wasn't there with the first one. But then sometimes after you realize you don't really know until you know again, and then all of a sudden it's good again. And did it get better, your orgasmic strength, after the first one?
After the O shot, yes.
Okay.
For sure.
And then did it decrease again before? I knew you were getting some mild incontinence again.
It did decrease a little bit, yes.
And then after that, is it better now, the orgasmic strength, or that has not improved like before?
I didn't see it improve as much as with this V-tone that I did with the O shot.
And you did the Votiva or the laser and the V-tone. So
Yes.
those are, again, the laser or Votiva is just one of our many ways to do laser. It's one of my favorite, where we're just doing radio frequency heating, surface heating for repair, and improves with all the functional improvement of, better blood flow, better orgasmic strength, urinary incontinence, all that, and vaginal laxity. So you get all that, and then V-tone's EMS to the pelvic floor, which you hadn't had. So I wanted to kind of vary it too but I think we were also focused a little bit. I knew you had some mild incontinence, but it'll be good to know, because then we'll know that the O shot, works for you. Sometimes it doesn't. It isn't the game changer between the two. And it's amazing to me. I'll hear some women say, oh, I like the Votiva better. The Votiva worked better than the O shot. And this is after the first one. So after the first one, I'm like, well, how would you know? You get them at the same time.
Yeah.
And so sometimes we don't know. And so these are almost like experiments like that we do. And so we can always, do that in the show.
Yeah. The V-tone has stopped the incontinence again.
Yeah.
It has. I just didn't have the fun with it like I did the positive perks of the O shot.
So we just may need to talk about that after the podcast. Yeah,
That's
of
right.
course, we want you to have fun
Right.
too. Yes. And it improves everything. So if incontinence is one of them, I just tell women there's a lot of things that come with
Yes.
that. So not only does it improve the incontinence, but you get, if you had any laxity, you get tightness. So the husband benefits from that too. And we get that friction we need. And then increased blood flow, lubrication, orgasmic strength, better nerve regeneration, all of that. The clitoris as well. And then we also do inject the PRP into the clitoris. So yeah, well, at least now it was a good thing to talk about, because you had both with improvement of all the functional and the orgasmic. But then the second one, the O shot, was obviously a bigger player with the orgasmic strength for you. So
yeah. None of them, there was nothing negative about any of them. All
Yeah.
of them have had positive results. It's just that the O shot gave you that sexual positivity for me, at least.
Yeah. Well, and that's really good for women to hear, though, because that's why it's called the O shot, the orgasmic shot. But also, those lasers work. I just feel, again, probably from my standpoint, if I'm looking at, because I had them reach back out to you and say the B-tone of Votiva, because B-tone is one that you hadn't had. So I wanted to introduce you, and I knew it was the myo-incontinence, but at least now we know that there's that orgasmic pep that we could do a little more enhancing of with the O shot. So
now I would say anybody who's in doubt, give it a try. It is so worth it, completely worth it. The biggest thing is just the modesty issue of, getting undressed and going through the procedure. But there was no pain. There was no downtime. For somebody who's modest like me, that was just a little uncomfortable, learning the procedures. But everybody in the office was so kind, starts talking to you, making you comfortable. So I didn't have any issues once the initial getting over my fears.
Yeah.
But one of the reasons I'm here today is because everybody needs to know about it, because we don't talk about this enough as women. I feel like I'm doing this again for like my daughter and her friends and the generations that come after us, because my mother, her generation didn't have this information like we're learning now. And if we can live longer, healthier lives with a lot of quality of life, then I'm going to get over my fears of speaking in public and share what I know.
And well, you've done great this entire podcast. Like, you've done great. And I think that it is so important because you're talking about hormones and the prevention and all the things leading up to that, like depression, anxiety, that were, again, impairing things in your life. Like, and so, and interfering with quality of life, right? Then that have changed. And that was just with what I consider natural. So not with drugs and not with surgeries, and even incontinence. Frequently, if you look at the recommendations, it's not good.
No, it's scary.
And surgery and meds isn't what people are looking for. And if you can, in the office, with just some treatments that don't have pain, don't have downtime, and definitely have proven safety profiles as well, can improve your symptoms. And those are things that get worse with time. So if you went with hormones unaddressed, or you actually just progress through menopause and, again, no hormones or no regeneration, then that urinary incontinence that was mild for you could become moderate, could become severe, and then it affects our sexual function and arousal and urinary tract infections, all the things. So I think that what you're doing is incredible. You have done great talking about it. And I would have never known you were modest and not a talker, because she talks away when she's in the office with me, which is great. And we both do. It's not just her, trust me. But I think that you talking about it helps women hear from you who've been through it. And again, questioned what it was, found the answers, didn't get an immediate fix. So it's not like we're sitting here saying, and she's actually a perfect example of a woman that might get lost to hormone and hormone replacement therapy because it wasn't an immediate. So if your primary doctor put you on, and sometimes back then it was even the gynecologist, they would do an estrogen. And if it wasn't estrogen, it was usually an antidepressant of some sort, which is what they offered you. And then if they do hormones, they do one and they dabble and you don't see them again and it's not customized, and you wouldn't have felt better because there was a lot of, close contact just to get you to the point where you felt better. And that's when women usually are lost. That's why I don't think traditional medicine is really going to do it well, because you can't be limited in the time that you can spend with us or we spend with you. And I can't have insurance dictating what kind of care I give or what kind of care you get.
Well, and so little of what we know and we learn is from the gynecologists, and they're not looking at all three hormones. And all three hormones are so important for us, and it's getting more prevalent now. We're learning more about that now. But lots of times testosterone conversations are just left out of the conversation completely. And it is so important. And that one's I didn't even realize that I was barely making just tiniest amount of that, and then so once you get it back in, my concentration was better and my memory was better and all of those things. It's like my vision got sharper once that testosterone came in, and those conversations would not have happened at the gynecologist's office.
Mm-mm. No, I always say it's kind of like the light switch going on
Hmm.
at times. And it could be that your vision's brighter, your hearing's better. Like, it's amazing the things that can happen with the testosterone optimization in women. And again, I think informed decision is the best way. Like, other people talking about whether, like, and I've heard people on podcasts or on videos talking about levels we are actually, the goal levels we're
Hmm.
reaching, about those being overdose levels.
Hmm.
And so again, I think they're missing the point, is that every woman is different. That's just one picture, one number. There's binding globulins, there's free testosterone, there's a balance of all the other hormones, and it's informed decision making. So if she's starting to get side effects, she needs to talk to us, because there's things that we can do and we can adjust, and
Hmm.
it might take us a while, but yeah, it's still crazy that there's so many misperceptions of testosterone.
One of the words that you used for the very beginning, and I have repeated it over and over again, and I've told my friends, I've told my friends' spouses, all of them, you use the word optimized. You don't want to just put me on the bell curve. You want me to be optimized for what is good for me. And so the levels that are good for me are not going to be the same as every other woman. But you have patiently worked with me every 3 months to make sure that my levels were where they needed to be at that moment in time. And if they got a little too high or a little too, like, we would increase them a little bit higher and higher. And so you made it comfortable for me to get over that taboo of, oh, they've got to be in this range or they are too high. But my testosterone levels that I take are significantly higher, but that's what optimizes it for me and makes me feel great.
Well, and when we talk about that goal range, because we sit down and talk numbers, I mean, we just talk numbers. I think women should just be informed and they should be educated. And if it's too much, they let us know and we simplify it. But if this is the goal, and somebody might feel better below it, somebody might feel better above it, but it also depends on whether they're binding it, what's free. But it actually just brings up a good point, is you did get to the point where she was a little high and she didn't feel as well. So we brought her back down, and now she has a specific range that we know she likes to be in, and she knows that range too. And so if it's too high, it's too much, and if it's too low, she doesn't feel well. But when you hear, if anybody's above 70, they're overdosed, then, I mean, and you hear the same things on social media that I hear, I'm sure, because what do you think when you hear some of the stuff that they talk about with testosterone?
Well, just like this, I just laughed.
Yeah.
If you are aware and you have somebody helping you and guiding you through this isn't just some flyby clinic, where I go in and get my beauty treatments and, hey, you want a shot of testosterone or something. This has been measured from the get-go, and you have been there every step of the way. I trust the process. I trust your knowledge. I've done my own research, and I just don't. When they say, their OB wouldn't even give them testosterone, or they did give them testosterone and it was too high and their hair started falling out and those kinds of things. And then when they called the doctor back and the doctor was like, oh, you're fine. Well, no. When I called back or I used the text and said, I'm not feeling well, it was an immediate, come in, let's get your blood work done. It was a constant, I was constantly cared for. So instead of being pushed off by the sidelines, I could have been lost in the system. I could have been lost in this whole process. But with this wellness program and things, I was like, well, I'm paying for it and this is part of it. And so they said, call if I don't feel well. And I have, and you all took care of me. So that's just when I hear my friends talking about it and how they've gone on testosterone and come back off because they've had some negative side effects. I feel bad for them because I do know that it is an up and down. But once you get that level, it really does optimize your life because you do feel so much better.
It is a fit both ways. So I'd say that, like, again, that's why I find it surprising that, because you're not, like, you are you're going to let us, I mean, I've always known how you feel when you feel a certain way, like you've never held back. And I love that. And our patients are actually very much like that. They're strong women that actually do educate, and they don't come in without questions and without pushback. And there's a conversation, and that's all okay. I'm not, and we at Revitalize and even, the other providers, we don't look at it as like we're the know-it-all, we're directing. It's a journey. It's your journey. We're there to direct. I do feel people should be informed. So, and if I feel pretty passionately about something, I will voice it. Again, like when you weren't feeling well and certain things, I'm like, no, let's do this. I think it's just going to take us a little while longer. Just, stick with it. And so we have those conversations, but I think it's a fit both ways. And so some of the friends, when you have those conversations, if they haven't jumped ship to actually try, then sometimes they won't, because some patients just feel like traditional medicine and those doctors or insurance-based programs are just what doctors should be doing. And frequently, because most of our patients that actually end up with us because they've tried the other options and it hasn't worked. And then they ended up with us because they're going to find a solution and they've educated and they know their solution's there. So they end up in front of us. But if those friends haven't ended up in front of us, sometimes they won't, just because, they're never going to be as proactive with it. But you can I still think you should continue having the conversations you're having, but.
Well, and I'm having those conversations because you and everyone that works with you encourages it.
Yeah. Oh, yeah.
Where it's not in a traditional office.
Yeah.
Right. You do get kind of pushed to the wayside. You do get lost a little bit, but you all have encouraged that. So it does empower you to be able to speak up and say, hey, something's not right. And we're in this together. And I think that's why you and I have been able to talk, is because it's, like I said, it's almost like a friendship instead of a doctor-patient relationship. Oh, yeah. So, people, I would say that if you talk to other patients in your office, they would feel the same as me, that they feel empowered and control of their health instead of just being passive participant in it.
Yeah, no, I was talking about, I definitely, we encourage, and I love the conversations. In fact, like, they're entertaining conversations, like, and there's never like a dull moment, throughout my day usually, because there's just good conversations. People bring things. We are learning from our patients all the time, but it's the other patients. I want you to continue having discussions with friends or people that haven't had a good experience with it, but sometimes they still are resistant. I have conversations with those same. I just went to Ohio State for the weekend and spent a weekend with college roommates and high school roommates, or high school friends and college roommates. And there's a couple there's one that wasn't on hormones, and we were talking about it. And I don't think she'll like quickly, explore it, but you got to keep trying and keep educating them. But I think that when it comes to, do you feel healthier?
Oh, yes.
Yeah. So when you hear all this stuff on social media that is like, again, all over the place, and I just think that women are good figuring it out on their own. You need to trust somebody. You need to trust that you've already researched, that there's solutions. You need to find somebody that you trust that actually does hormones. And then that journey together, you'll know whether you feel better, whether you're having side effects. And again, the behind the scenes overdosing things, you feel a lot healthier when you're optimized. And I think women are quite capable of making those informed decisions for
Not
themselves.
only do I feel healthier, I feel younger. I just had my 50th birthday, and I feel younger now than I did at 40, when that's probably when all the symptoms started. And so I feel like I'm living life better now and happier than I was 10 years ago.
I love hearing that. Love it.
And I've lost 15 pounds or so in the 2 years, just naturally. I mean, I've always walked and, lifted weights here and there and those kinds of things. But getting my hormones balanced, there's been a lot of people that, what are you doing? And I'm like, well, I've got my hormones leveled, Yeah. I'm balanced now. And
living.
Other women are like, really? And I'm like, yeah, maybe you should get your hormone levels tested, because you never know if that weight gain is because you're estrogen dominant or what it could be. Yeah. So there's been a lot of perks and benefits to it that's why I'm here.
Oh, I love it. Well, there's two other reasons why you're here. It was the title, like the first line of the podcast too, right?
Yes.
Is that initiating again?
Yes.
And again, that's actually a frequent complaint from men on some of the videos, is that, their significant other doesn't initiate anymore. So tell us about that. And duration and whether he can keep up with you now. You don't have to share all of it. It just depends. Don't hold back for your case or for your sake, but maybe his.
Yeah. Sorry, sweetie. No, I am initiating more often and frequently. I have a nice drive myself, and it also helps, that the kids are older and out of the house and those kinds of moving out of the house and getting out of the house. But it's just a natural thing now to want to be with my husband, and we're more intimate and closer now than we were even when we first started dating. There are times he's like, okay, I need a break. Give me a day or two. And I'll just laugh and I'm like, come on. And we've joked about how the balance of, sometimes now it makes sense for an older woman to be with a younger guy, because of the differences in the drives, but he's got a natural higher drive. Yeah. And so, now he doesn't have to be the one begging all the time and asking, and
you flipped the script on him.
I have flipped it, yes.
I love it. Yeah, so we were coming back to that at the very end, but no. Well, thank you so much for sharing your experience with all of it. And I know it wasn't the easiest thing to do, because she says she's like, I don't know if it was like modest, but like, yeah, I just never got that from you before, but I love it. And again, I would love that you shared your experience with both the hormones, the journey in getting there, the difficult journey with it, and then the sexual wellness procedures. And I think the men that are listening also would love to hear that. Yes, the women can initiate when their hormones are optimal. Mm-hmm. Their sex drive can be just as high. We have this conversation frequently with women because some women, if sex drive is a big change for them and it's affecting the relationship, they come in because of it and they're not initiating it. They don't want sex. And at times I'll say, listen, you may need to send your husband after when we get you optimal. And they almost laugh thinking that's not going to be the case. And then it ends up being the case. Yeah. So I love that you shared it. They can initiate again and actually wear your ass out.
Yeah, that's right. Yeah.
All right. Well, thank you for coming and sharing with us. And then let us know if there's any questions. Start a conversation in the comments and let us know if there's anything else you want to deep dive into wellness or sexual wellness.